Welcome to British Biomedicine Institute. Today, Dr. Pramod Khatre, is going to represent a simple topic named as Nutraceuticals and Pharmaceuticals. The term Nutraceuticals combine the word nutrients, or we can say a nourishing food or a food component, with pharmaceuticals, or we can say a medicinal product. So basically, nutraceuticals are a food with medicinal health benefit, which include prevention and treatment of a disease. The term was coined in the late 1980s by Stephen D. Felice, who was the founder and chairman for the Foundation of Innovation in Medicine. And basically, it is commonly defined by the dietary supplementary industry as any non-toxic food or component which has scientifically proven health benefit, including disease treatment and prevention, can be named as nutraceuticals. So several terms need to be defined in order to gain an understanding of the nutraceuticals. First one is nutrients, second one is feed, third is food, and fourth is drug. So nutrients, basically a feed, it is a feed constituent in the form of or at a level that will help support the life of an animal. The chief class of the feed nutrient can be protein, fat, carbohydrate, minerals, and vitamins. Whereas feed is basically an edible material which are being consumed by the animals, and they can contribute to the energy or to the nutrients in the animal diet. Whereas food, as defined by the FDC, Food, Drug and Cosmetic Act, which was framed in 1968, an article that provide taste, aroma, or nutritive value is known as a food ingredient which will be beneficial for the human body. Whereas drug is a substance which is intended for use in the diagnostic care, mitigation, treatment and prevention of a disease in human beings, or we can say a substance other than the food intended to affect the structure or any function of the body of a man or other animal. So, dietary supplements as defined by the DSHEA, which was framed in 1994. The DSHEA full form is Dietary Supplement Health and Education Act, and they define dietary supplement as a product which contain one or more of the following dietary ingredient like vitamins, minerals, herbs, and other botanical or amino acids like proteins. And they also include a possible component of a diet as well as concentrates and the constituents, or we can say extract or metabolites of these compounds. So interest in the nutraceuticals. So basically nutraceuticals have the potential to play a role in healthy eating and to contribute in the prevention and treatment of a disease, so that functional component in the food could explain the role of disease prevention and the treatment. And nutraceuticals, they are preferred due to number one point, since new molecules are difficult to discover and they are more expensive and the risk than ever before. Many pharmaceutical companies are now trying to nutraceuticals, so that they are undoubtedly a very huge and growing market. The belief among consumers that these food-like substances are either harmless or least toxic as compared to the conventional pharmaceuticals. There is an increased healthcare cost with conventional pharmaceuticals. There is a recent legislation and scientific discoveries. Next point. Inappropriate dietary habits are seen as contributing to the leading cause of the death of the patients due to coronary heart disease or cancer, And here the role of nutraceuticals in the treating this condition is very much important. Nutraceuticals are gaining popularity as people are relying on them for safeguarding their health and avoiding side effects which are associated with the drugs as well. Long history of use and better patient tolerance as well as public acceptance is also a main point for the preference of nutraceuticals, and plant constitute to be major source of new lead generations. So now comes the nutritional supplement. So basically they are helping in aging baby boomer, provide energy and preventive care early senior, health maintenance care late senior, rising heart and bone problem among aged population, dissatisfaction with modern medicines like there is increased side effect, rising healthcare cost in modern treatment, whereas there is an increase in acceptance of alternative treatments like they can be economical, they have less side effects and they are in use with the disease which are untreated with the modern medicines. So now comes the classifications. The food product which are being used as a nutraceuticals, they contain the following except probiotics, as all the components are available in the fruits, vegetables and different types of herbal foods, like they can provide you the constituents like antioxidant, prebiotic, probiotic, omega-3 fatty acids and dietary fibers. These are all available in vegetable and fruit. Antioxidants. So basically these are the substances which retard or prevent deterioration, damage and destruction caused by the oxidation. The common disease and ailment in 21st century is CVS, cardiovascular disease, diabetes, cataract, high blood pressure, infertility, respiratory infection, rheumatoid arthritis. They all are associated with tissue deficiency, or if there is a low dietary level of compound called antioxidants. During oxidation, the free radicals they get generated. These free radicals at a molecular level even burn every day, and antioxidants are powerful electron donors and they react with free radical in the biomolecule. And the formed antioxidant radical is stable and it is basically unreactive. So the antioxidants are quite large in number and diverse in nature, which oppose the process of oxidation largely by neutralizing the free radicals at relatively small concentration, as they have the potential to inhibit the oxidant chain reaction. Dietary antioxidants and some SSC molecules such as zinc or certain vitamins are important in maintaining free radical scavenging systems, or we can say biosynthesis, synthetic capacity and membrane or enzyme level. Antioxidants can also be found in vegetable oils like your soybean, canola oil, corn oil, palm oil, wheat germ oil, oat oil and even prime rose oil. So under the classification of antioxidants, vitamins they are basically available in vitamin C and vitamin E, whereas carotene is available in the form of beta carotene and lycopene. Thiol they are available in lipoic acids and glutathione. Enzyme selenium is available as a coenzyme Q10 superoxidase desmatase or selenium, whereas minerals are available in the form of copper, magnesium and zinc. Probiotics. So basically these are the live microbial food ingredient which are beneficial to the health. Colon is the most densely populated region of the GI tract, gastrointestinal tract, and harbor an estimated of 500 different bacterial species. So probiotics Probiotic bacterial processes species, they consist of like your lactobacilli or lactobacillus rhamnosus, lactobacillus reuteri, lactobacillus case, bifidobacterium brevi or streptococcus. These are the bacteria which show the characteristics of probiotics. So the characteristics of probiotic bacteria are: the bacteria should have the following features, like they are generally safe, in vitro resistance to hydrochloric acid and pancreatic juice. They can also produce antimicrobial substance. They can compete with bad bacteria in order to, and they also adhere in the gut wall. They can compete with the nutrients and they can stimulate immunity, and they can alter the intestinal microflora balance, inhibit growth of harmful bacteria, and they can promote good health, boost immune function, and they can increase resistance to the infection. Prebiotics. So prebiotics basically are the substance which reach to the colon in intact form, that is without getting depleted by the gastric pH or by the digestive acids. These prebiotics are selectively promote the growth of colonal probiotic bacteria. Hence, they can act as a fertilizer for these bacteria. These are collective terms for non-digestive but a fermentable dietary carbohydrate that may selectively stimulate growth of certain bacterial groups, or we can say residents which are available in the colon, like your bifidobacteria or lactobacilli, as they are considered beneficial for the human host. Inulin, which is a soluble dietary fiber, and it is resistant to the digestive enzyme and thus reach to the large intestine or colon essentially intact, where it is fermented by resistant bacteria like lactobacilli. There are a range of oligosaccharides which has been tested using various in vitro methods, like in animal models or in human clinical trials, like fructo-oligosaccharides, inulins, lactulose, soybean oligosaccharides, lactosucrose, isomalto-oligosaccharides, or gluco-oligosaccharides, or xylo-oligosaccharides. So the food component of or ingredient of prebiotics are: they resist in host digestion, absorption, or processes. They can be fermented by microflora colonizing the gastrointestinal system, and they can selectively stimulate the growth and the activity of one or more bacteria which are available inside the gastrointestinal system. Polyunsaturated fatty acids. So basically these are the essential fatty acids which are needed for normal growth and development, but they cannot be synthesized by our body. For example, omega-3 fatty acid belongs to this class. Long chain omega-3 fatty acids like your eicosapentaenoic acid or docosahexaenoic acid are built up in algae and planktons and in the living fish living on them, and fish they survive on them. The natural vegetable oil or marine animal oil which contain polyunsaturated fatty acids belongs to linoleic group, or we can say omega-6 type or omega-3 fatty acid, as they help in reduction of cholesterol formation or deposition, and they can prevent thrombosis formation. For example, sunflower oil, corn oil, soybean oil, mustard oil, and marine fishes, and even flax oil, hemp seed, and borax seeds, they are beneficial. The following are diseases from which polyunsaturated fatty acids are preferred, like your heart attack, stroke, rheumatoid arthritis, inflammatory bowel disease, asthma, cancer, chronic lung failure, or kidney transplant. Dietary fiber. So dietary fibers are used in health product for normalization of intestinal transit time. They have dual effect in intestinal transit. First effect will be on the bulk fishes, which are often increased in substantial proportion, or we can say 127% after ingestion of 20 gram of wheat bran. This action with insoluble fibers. The other effect, if dietary fiber are upon the duration of a transit, which get normalized around 48 hours, long transit time get shortened and short time get longer. Dietary fibers are categorized into two groups. We can say water soluble fibers or soluble fibers, which get dissolved in water and they can form a gel which bind to the stool and they can inhibit non-propulsive colon construction, and they can help in bulking of the stool and their quick passage through digestive tract. For hair, oats, dry bean, legume and chicory, they are helpful or they are beneficial. Another type is water soluble fibers. Basically they are insoluble fibers which are present in the brown rice, banana, vegetable whole grain. And the source of dietary fibers are your fresh fruit like your apple, orange, apricot, plum, pineapple with fiber which consists of 18 to 30%, whereas vegetables like your cabbage, carrot, lettuce, onion, tomato, they have a fiber which ranges from 9 to 12%. So now comes pharmaceuticals. So the basic definition of pharmaceutical drugs are a medicine which can be loosely defined as any chemical substance which is intended for use in the medical diagnosis, cure, treatment or prevention of a disease. The word pharmaceutical comes from a Greek word, pharmakemia. The modern transliteration of pharmakemia is pharmacia. Classification. So basically classification can be done on the basis of their chemical property, their MOA, mechanism of action or mode of route of administration, or biological system affected by the therapeutic effect. An elaborate and widely used classification system is your ATC, anatomical, therapeutic chemical classification system, or a list of essential medicines. They are being maintained by the WHO. So a sampling of classes of medicines include like antipyretic. Basically they helps in reducing the fever, or we can say pyrexia or pyresis. Analgesic, they reduce the pain, or we can prescribe painkillers. Various medicines are available. Antimalarial drugs, they treat malaria. Antibiotic, they inhibit germ growth. Antiseptic, they prevent germ growth and like germ growth near to the burn, cut or to the wounds. So under the type of medications, or we can say pharmacotherapy, for gastrointestinal tract or digestive system disease, we can prescribe various medicines. So if a patient is suffering from upper digestive tract, then we can recommend antacids, reflux suppressant, antifluentants, antitopaminergic, proton pump inhibitor or H2 receptors, antagonist, cytoprotectants, prostaglandin analogs can be given. And if a person is suffering from lower digestive tract, then we can give laxatives, antispasmodics, anti-diarrhea or bile acid, sequestrant and opioids, they can be given. And for cardiovascular system, we can give the beta receptor, beta blockers, calcium channel blockers, diuretics, cardiac glycosides, antiarrhythmia, nitrate, anti-anginal, vasoconstrictor, vasodilator or peripheral activator. And For antihypertensive drugs, which consist of ACE inhibitor, angiotensin receptors blocker or alpha blocker, or calcium channel blocker. For CNS, calcium central nervous system, which can include your hypnotics, anesthesia, antipsychotics, antidepressant. Basically, they include tricyclic antidepressant, monoamine oxidase inhibitor, or lithium salt. And we can also give SSRI, selective serotonin reuptake inhibitor, antiemetics, anticonvulsant, anti-epileptic, and anxiolytic or barbiturates. They can be given. And if there is a moving disorder, or we can say a patient is suffering from Parkinson's disease, then we can give amphetamine medicines. Benzodiazepines can be given. Cyclopyrrolone, dopamine, antihistamines, cholinergic, anticholinergic, emetics, cannabinoids, and 5-HT, or we can say serotonin antagonist, can be prescribed to these patients. For pain or consciousness, we can prescribe analgesic drugs. Like the main class of painkillers, they are NSAIDs, non-steroidal anti-inflammatory disease. We can give opioids or various orphan drugs like your paracetamol. For musculoskeletal disorders, we can give medicines like NSAIDs, which can include COX-2 inhibitor, muscle relaxants, neuromuscular drugs, and anticholinergic drugs. For eye disorders, generally we prescribe analgesic, neuron blocker, astringent, or ocular lubricant. And for antibacterial, we can prescribe antibiotics, topical antibiotics, or sulfur drugs, or aminoglycosides, or fluoroquinolone. For antiviral and for antifungal, we can prescribe polynine, imidazole. These are medicines which are prescribed for antifungal infection. For anti-inflammatory, NSAIDs medicine can be prescribed, or corticosteroids, they can be given. For anti-allergic, mast cell inhibitor medicines can be prescribed. For anti-glaucoma, adrenergic agonist, beta blocker, carbonic anhydrase inhibitor, or hyperosmotic, cholinergic, or mitotic parasymptomatic, prostaglandin medicines agonist or prostaglandin inhibitor, or nitroglycerin, they can be prescribed for anti-glaucoma treatment. For ear, nose, oropharynx, basically we will be prescribing symptomatic, antihistamines, anticholinergic, NSAIDs, steroids can be given, antiseptic, local anesthesia, and antifungal medicines can be given. For the respiratory system, we can prescribe bronchodilators, NSAIDs, anti-allergic, anti-tissue, mucolytics, decongestants, corticosteroids can be given, beta-adrenergic can be given, and anticholinergic and steroids, they can be prescribed for anti-respiratory system. For endocrine problems, basically we can give androgen, anti-androgen, or gonadotropin, corticosteroids, human growth hormones can be given, insulin, anti-diabetes like sulfonylurea, biguanides, metformin, thiazolidines, or insulin, or thyroid, and for thyroid hormone, or we can also give anti-thyroid drugs, calcitonins, diphosphate, and vasopressin analogs. For reproduction system or for urinary system, we can give antifungal or alkalizing agents, quinoculone, antibiotics, cholinergic or anticholinergic medicines can be prescribed. Anticholinergic, cholinesterase or antispasmodic, or 5-alpha reductase inhibitor, selective alpha-1 blocker, sildenafil, or fertility medications, they can be given for reproduction or urinary system. For contraception, we can give spermicides or milozepine or hormonal contraceptions. For OBS and gynae, we can prescribe NSAIDs, anticholinergic, hemostatic drugs, antifibrinolytics, HRT, hormone replacement therapy, bone regulators, beta receptor agonist, follicle stimulating hormones, luteinizing hormones, LHRH, gimolinic acid, gonadotropin release inhibitor, progesterone, dopamine agonist, estrogen, prostaglandin, gonadorelin, clomiphene, tamoxifen, and diethylstilbestol. They can be prescribed for OBS and gynae related problems. For the skin, so basically we can prescribe emollients, antipyresis, antifungal, antidisinfectant, or scabicides or pesticides, like the tar products like vitamin A derivatives can be given, vitamin D analog or keratinolytics, abrasives, systemic antibiotics, topical antibiotics, hormones, exudates, absorbent, fibrolytic, proteolytic, sunscreens, antiperspirant or corticosteroids. They can be given for skin related infections. For infection or infestation, antibiotic, antifungal or antileprotic, antituberculosis or antimalarial, antihelminths, and amoebicides, antiviral or antiprotozoal medicines. They can be prescribed for infection or infestation related disease. For the immune system, basically we can get vaccines, immunoglobulin, immunosuppressant or interferons, and we can also give monoclonal antibodies. For allergic disorders, but particularly we prescribe NSAIDs, antihistamines, and anti-allergic drugs. For nutrition, we can prescribe tonic, electrolytes, mineral preparations which include iron preparation or magnesium preparation, parenteral nutritional supplements or vitamins, anti-obesity drugs, anabolic drugs, hematopoietic drugs, and food product drugs. They can be provided for nutritional value to the human body. For neoplastic disorders, we can give cytotoxic drugs, therapeutic antibiotics, sex hormones, aromatase inhibitor, stomatostatin inhibitor, recombinant interleukins, GCSF, erythropoietin medicines. They can be prescribed for the cancer patients or for neoplastic disorders. For euthanasia, so basically euthanasia is used for or we can say it is basically a physician related assisted suicide. So euthanasia is not permitted by law in many countries, and consequently medicines will not be licensed for these used in various countries. So this is all about the presentation. I hope you have gained a lot of clinical information through this presentation. Please like, share, subscribe our YouTube channel named as British Biomedicine Institute. Good luck, goodbye.